Bonjour à tous. Good morning, everyone. Before I get started, I want to speak very quickly about the call I had earlier this morning with President Zelensky of Ukraine. The President and I discussed our shared concerns about recent Russian military activity and ongoing aggression in the Donbass and in Crimea. On our call, I reaffirmed Canada's unwavering support and friendship for Ukraine's sovereignty and territorial integrity, as well as our commitment to further deepening our long-standing friendship with Ukraine. Pour beaucoup de gens, la longue fin de semaine a été l'occasion de faire des réunions de famille sur Zoom ou de passer du temps à l'extérieur. Mais ce n'était pas un congé pour tout le monde. Aux quatre coins du pays, des infirmières, médecins, traceurs de contacts, des membres du personnel de la santé publique étaient au travail. Ils sont là pour assurer notre sécurité et on doit en faire autant pour eux. Ce qu'ils nous disent et ce que toutes les modélisations confirment, c'est que la situation est très préoccupante. Around the world, countries are facing a very serious third wave of this pandemic. And right now, so is Canada. This isn't the news any of us wanted, but hospitalizations are surging. ICU beds are filling up. Variants are spreading, and even people who had convinced themselves they didn't need to be concerned are getting sick. Even if the sun is shining and the weather is getting warmer, COVID-19 isn't done with us yet. And that means we all have to hold tight a little longer. Later today, I'll speak to Premier Ford about the situation in Ontario. I know we'll talk about what the spike in cases means for hospitals and the importance of vaccinating as many people as possible, as quickly as possible. We'll continue working together to keep Ontarians safe and support people and businesses through this next wave. On that note, I'll also be speaking to all premiers tomorrow about our continued and shared work to protect and support all Canadians right across the country. Tant qu'on n'aura pas vacciné le plus grand nombre de personnes possible, il faudra continuer à se protéger les uns les autres en suivant les conseils de santé publique. Un peu partout, dépendamment de l'augmentation ou de la diminution du nombre de cas, les règles devront être modifiées. L'Ontario, la Colombie-Britannique et le Québec ont déjà fait le choix difficile mais nécessaire de prendre des mesures plus strictes pour freiner la montée en flèche des cas. C'est pas facile et on sait que les mesures vont peut-être devenir encore plus strictes, mais c'est ce qu'il faut faire. On fait ça pour sauver des vies. We need to flatten the curve to save lives. To young people, you've made tremendous sacrifices over the past year to protect your parents, grandparents, and the heroes on the front lines. Thank you. You are saving lives. We need you to keep doing this a while longer. If you can stay home, please do. And to frontline workers, I know you're tired, exhausted. I know you're really scared about what the coming weeks could bring because you're seeing the seriousness of these new variants and the spike in cases. You have done an unbelievable job over the past year. Know that we will continue to be there for you, and we will get through this together. If you need to take time off because you're sick or self-isolating, we've made sure the Canada Recovery Sickness Benefit is still there for you and any worker who needs it. In fact, we've added 2 more weeks to that benefit. Go to canada.ca to see how you can qualify because no one should be going to work sick right now. Of course, if you need PPE on the job, we're continuing to get you that. And above all, we're working around the clock to get vaccines delivered. Vous connaissez probablement des gens qui ont reçu leur première dose, ou peut-être l'avez-vous reçue vous-même. Vous savez donc que chaque dose compte. On a déjà livré plus de 10 millions de doses de vaccins aux provinces et aux territoires. On n'a pas seulement atteint notre objectif pour mars, on l'a largement dépassé. Et à partir de maintenant, les doses vont continuer d'arriver de plus en plus vite. Ce mois-ci et le mois prochain, on va recevoir plus d'1 million de doses par semaine de Pfizer seulement, en plus des livraisons de Moderna et AstraZeneca. Plus tard ce mois-ci, Janssen va aussi commencer à livrer son vaccin au Canada. Et comme je l'ai dit la semaine dernière, Pfizer a confirmé qu'ils allaient devancer 5 millions de doses pour juin. Ces doses étaient prévues pour la fin de l'été. On va maintenant les recevoir plus tôt. La ministre Anand et son équipe, ainsi que l'Agence de la santé publique du Canada, travaillent sans relâche pour devancer et coordonner les livraisons. On fait tout ce qu'il faut pour que les vaccins puissent être administrés le plus rapidement possible. Our government is delivering over 1 million doses a week to the provinces and territories, and we'll keep making sure these vaccines get to people as quickly as possible. As Deputy Prime Minister Freeland announced, we're providing additional support to the provinces and territories for their pressing needs on vaccine rollout. The federal government has paid for the vaccines, and we're happy to continue to help with more resources as needed. Because this is no time to go back and forth over who should pay for what. This is the time to do everything we can together to get as many people vaccinated as soon as possible. From day one, beating COVID-19 has been a Team Canada effort. Last summer, we delivered $19 billion through the Safe Restart Agreement to support the provinces and territories on what Canadians needed to get through this crisis. That money has helped with everything from additional staff at seniors' homes in Alberta, to modeling in BC to help keep communities safe, to mobile testing in Nova Scotia to reach rural areas. Today, we're delivering on the final installment for that Safe Restart Agreement. Our priority is for funding to go where it's needed most, whether it's for patients in hospitals, PPE for essential workers, or COVID-19 testing and screening for people on the front lines. Tout comme le premier versement, l'investissement de 700 millions de dollars annoncé aujourd'hui dans le cadre de l'accord sur la relance sécuritaire permettra d'assurer la sécurité des gens et d'aider les familles et les petites entreprises à traverser cette tempête. De tout l'argent investi au Canada pour lutter contre cette pandémie, 8 $ sur 10 provient du gouvernement fédéral. On veut aider les gens à traverser cette crise et faire en sorte que notre pays soit en bonne position pour rebâtir en mieux. Before I end this morning, I want to take a moment to recognize that this will be an especially difficult day for a lot of people. It's now been 3 years since the terrible Humboldt Broncos crash. Today, we remember 16 people taken from us much too soon. And as we do, we stand with the families, friends, and teammates whose lives were changed forever. To people grieving across the country, we're thinking of you. I can only imagine how hard it is for you not to be able to gather on this day. And to everyone who continues to recover and rebuild, your strength is remarkable. Every day, all Canadians stand with you. Merci. Je vais maintenant céder la parole à la docteure Tam. Teresa.
Bonjour à toutes et à tous. Over 1 million cases of COVID-19, including over 23,000 deaths, were reported since the start of the pandemic in Canada. And this is a stark reminder of how much we've been through. With more contagious variants driving epidemic growth in many areas of Canada, we know this virus is not going out with a whimper. But our vaccine response is getting stronger every day, and we will get through this pandemic together. Just yesterday, we marked the milestone of delivering 10 million COVID-19 vaccines to provinces and territories. Over the past week, on average, there have been almost 6,100 new cases and 31 deaths reported daily. With an ongoing increase in severe and critical illnesses placing a heavy strain on the health system in many places, it is clear that community-based restrictions will be needed a while longer. Last week, an average of almost 2,400 people with COVID-19 were being treated in our hospitals each day, representing a 4% increase over the previous week. This includes over 780 people in intensive care units, which is a weekly increase of 18%. With increasing rates of infection, we are seeing a greater number of younger adults with COVID-19 being treated in hospital. This is a reminder that COVID-19 can impact people of all ages, and severe illness can occur at any age. Variants of concern are contributing to the current resurgence. The B117 variant is known to cause more severe illness and increase the risk of death. Of the over 15,000 variants of concern cases reported to date across Canada, the B117 variant continues to account for over 90% and has likely replaced the original virus in some locations. A significant increase in the number of cases of the P1 variant is also cause for concern. Cases due to this variant rose from about 460 cases a week ago to now 857 cases reported in Canada, with the majority of these reported by British Columbia and Ontario to date. Early evidence suggests that the P1 variant may reduce the effectiveness of vaccines, making it even more important to control its spread. With variants of concern posing new challenges in different locations across the country, now is not the time to travel across the regions for recreational reasons. Limit your travel to essential trips only to do your part to stop spread. Tomorrow marks World Health Day, bringing attention to a specific health concern common to many people around the world. This year's theme, Building a Fairer, Healthier World, serves to remind us of the inequitable impact that COVID-19 has had for many people in Canada and around the world. It also challenges us to ensure that our pandemic response prioritizes interventions that will support good health and safe recovery. Building in actions to address inequities in our response makes us stronger and more united. I know that we're all tired and looking forward for a break, but now is not the time to let down our guard or travel for recreational purposes. Please continue to follow local public health recommendations, stick to the safer habits we've learned, and get a vaccine when it's your turn. The bottom line is no one is protected until everyone is protected. Thank you.
Bonjour à toutes et à tous. Depuis le début de la pandémie au Canada, il y a eu plus d'1 million de cas de COVID-19, dont plus de 23 000 décès. C'est un rappel sévère de toutes les épreuves que nous avons déjà subies. Les variants les plus contagieux étant à l'origine de la croissance de l'épidémie dans de nombreuses régions du pays. Nous savons que ce virus ne disparaîtra pas sans laisser de traces. Cependant, de plus en plus de gens sont vaccinés chaque jour et nous nous sortirons de cette pandémie ensemble. Nous avons atteint hier le jalon des 10 millions de doses de vaccins livrées aux provinces et aux territoires. Au cours de la dernière semaine, presque 6 100 nouveaux cas et 31 décès ont été signalés en moyenne chaque jour. L'augmentation constante du nombre de cas graves et critiques exerce une forte pression sur le système de santé dans de nombreuses régions et il est évident que les restrictions communautaires devront être maintenues pendant un certain temps encore. Au cours de la semaine dernière, une moyenne de
Okay, while we wait for the technical issues with Dr. New, let's open the questions for media.
nous rappelle que la COVID-19 peut toucher des personnes de tout âge et que les personnes de tout âge peuvent tomber gravement malades. Les variants préoccupants y contribuent. Nous savons que le variant B117 peut rendre les personnes plus gravement malades et augmenter le risque de décès. Parmi plus de 15 000 cas de variants préoccupants signalés à ce jour au Canada, le variant B117 continue de représenter plus de 90 % des cas et a probablement remplacé le virus initial à certains endroits. Nous sommes également préoccupés par l'augmentation importante du nombre de cas du variant P1. Le nombre de cas de ce variant est passé de 460 il y a une semaine à 857 en ce moment au Canada, dont la majorité de ces cas ont été signalés en Colombie-Britannique et en Ontario. Les récentes données probantes indiquent que les vaccins pourraient ne pas être aussi efficaces contre le variant P1, ce qui rend le contrôle de sa propagation encore plus important. Puisque le variant préoccupant pose de nouveaux défis dans diverses régions du pays, ce n'est pas le temps de se déplacer dans d'autres régions pour des raisons de loisirs. Limitez vos déplacements à ceux qui sont essentiels pour contribuer à arrêter la propagation. Demain sera la Journée mondiale de la santé, qui vise à sensibiliser la population à un problème de santé particulier commun à de nombreuses personnes dans le monde. Le thème de cette année, pour un monde plus juste et en meilleure santé, met en évidence les inégalités des conséquences que le COVID-19 a eues sur un grand nombre de personnes au Canada et dans le reste du monde. Il a également comme objectif de nous mettre au défi de garantir que notre réponse à la pandémie privilégie les interventions qui favoriseront une bonne santé et un rétablissement sûr. Les mesures concrètes prises pour combattre les inégalités dans notre réponse nous rendent plus forts et plus unis. Nous savons que nous sommes tous fatigués et que nous voulons une pause, mais ce n'est pas le temps de tout laisser tomber et de voyager pour des loisirs. Veuillez continuer à suivre les recommandations de santé publique locale, à vous en tenir aux habitudes plus sûres que nous nous sommes créées et faites-vous vacciner lorsque ce sera votre tour. Rappelons-nous que personne n'est protégé tant que tout le monde n'est pas protégé. Merci.
Thank you, Dr. New. We'll now turn to questions from media. We'll start on the phone. One question, one follow-up. Operator.
Thank you. Merci. Please do not hesitate to press star 1 on your device's keypad. N'hésitez pas à faire étoile 1 sur votre appareil. Première question, Marie Vastel, Le Devoir. À vous. Marie Vastel?
Oui, bonjour, vous m'entendez? Ben, je m'entends en écho, donc vous devez m'entendre, j'imagine. Je ne sais pas si ma question est pour vous, M. Trudeau, mais peut-être que la ministre Haïdou voudra rajouter quelque chose. Je voulais savoir où vous en êtes dans votre réflexion sur le passeport vaccinal, surtout pour ce qui est de la situation avec les États-Unis. On a vu que la CDC a changé ses règles récemment pour les voyages en disant que les gens qui sont complètement vaccinés sont très peu à risque. Il y a beaucoup de pression, on le sait, des deux côtés de la frontière pour ouvrir la frontière avec les États-Unis, du côté de gens qui ont une famille, des membres de leur famille qui sont séparés ou du côté des entreprises. Donc, est-ce que vous comptez assouplir les règles pour les gens qui sont complètement vaccinés, ne serait-ce qu'avec les États-Unis, puisque la question va bientôt se poser, là, comme la vaccination avance très rapidement au sud de la frontière?
Non, merci pour la question, Marie. Je sais qu'il y a plein de gens qui pensent à ce qu'ils pourraient faire cet été, à reprendre des voyages, des visites de famille, mais on n'est pas là encore, évidemment. On est dans une troisième vague qui est extrêmement sérieuse et les gens doivent faire énormément attention pendant les semaines à venir pour vraiment aplatir la courbe. C'est la grande priorité. Évidemment, on espère tous pouvoir rouvrir les frontières et recommencer à voyager dans les mois à venir. On va continuer de travailler avec nos partenaires aux États-Unis et à l'international pour veiller à ce que ce soit fait comme il faut. On a déjà vu l'importance de preuves de vaccination pour voyager à l'international déjà. dans une période pré-pandémie dans les dernières années. Ça va sûrement être important, mais les détails de ce qu'on va faire pour ça, on est encore en train de les fignoler, de les travailler. Mais évidemment, comme tu as souligné, c'est pas pour tout de suite. On est dans une troisième vague. On doit continuer de tenir bon pour quelques semaines encore pour vraiment aplatir la courbe et permettre aux vaccins qui vont arriver par les millions dans les semaines à venir de faire effet. Patty.
Well, thank you very much. And the Prime Minister is absolutely right. Now is not the time for Canadians to be thinking about traveling as we work so hard to flatten the curve. And we, thank the many, many Canadians who are sacrificing in ways that we see, in ways that we don't see. I'll just say that on the topic of vaccine passports for international travel, of course, we remain committed to having those conversations with our international partners because however that conversation evolves, we want to make sure that Canadians have the right kinds of documentation for future travel.
Oui, merci. Je comprends que c'est pas une question qui se pose demain, mais il reste qu'il y a d'autres pays où la vaccination est franchement plus avancée que chez nous. C'est peut-être pas le moment pour les Canadiens de voyager, mais il y a des gens qui ont reçu leurs 2 doses de vaccin ailleurs, qui voudraient peut-être revenir ici pour des raisons d'affaires, des gens d'affaires ou pour des raisons personnelles. Donc, est-ce que vous avancez là-dessus à savoir si on va assouplir les règles pour les gens qui voudraient venir ici s'ils sont complètement vaccinés? Et qu'est-ce que vous entendez faire pour les gens qui seraient vaccinés avec un vaccin qui n'est pas approuvé au Canada? Les gens se demandent s'ils reçoivent le vaccin chinois ou le vaccin russe, par exemple, dans certains pays, mais ce n'est pas reconnu au Canada. Est-ce que ça va être accepté comme preuve de vaccination pour entrer au pays?
C'est une autre bonne question, Marie. La réalité, c'est qu'on va se baser sur la science à chaque étape. On va regarder les études, on va continuer de coordonner avec nos partenaires comme les États-Unis qui pourraient vouloir faire des mouvements avant nous, mais on va s'assurer de faire ce qui est nécessaire pour protéger les Canadiens à chaque étape. On continue de suivre la science et d'écouter les recommandations des experts en santé publique pour nous aider à établir quelles mesures sont appropriées pour les gens qui sont vaccinés, pour les gens qui seraient vaccinés avec des vaccins pas approuvés. On va vraiment attendre la science là-dessus.
Next question, operator.
Thank you. Merci. Next question, Kate Bolingaro, Bloomberg. Line open.
Hi, Prime Minister. My question is for you. I am wondering, what does Janet Yellen's push for a harmonized corporate tax rate mean for Canada?
Well, I think we're all looking forward to conversations at the G7, at the G20 in the coming months with the international financial institutions about how we're going to not just get through this crisis and come back stronger everywhere, but how we can ensure that our international financial systems and institutions are the right ones for the coming decades. I think there's a lot of lessons that we've learned from this pandemic that we're going to be able to talk about all together, and we'll be open to hearing various proposals on how to make sure that growth is inclusive, that opportunities are there for everyone around the world. Canada will always look to ensure that we are competitive with other countries around the world in terms of taxes.
No follow-up, Kate?
And President Biden is urging the U.S. to open up vaccines for all citizens on April 19th. And what is your comparable date for Canadians?
As I've said, we intend to have every Canadian fully vaccinated who wants one by the end of the summer. We have passed our milestone that we'd promised for the end of March of having 6 million vaccines. As you've just heard, we're actually over 10 million vaccines delivered. So we're doing well, but there's a lot more to go. The tentative numbers we have out is we're optimistic about having more than 44 million doses of vaccines arrived in Canada by the end of June. Various provinces will do the math differently, will sequence different populations, as is right, with different postures in this disease across the country. Our job as a federal government is to work every single day to get more doses to this country as quickly as possible. This past week was a record week, but we're looking forward to getting even more in the coming weeks. That's what Minister Anand and her entire team are working on every single day. We know getting as many vaccines as possible, as quickly as possible, is the way we get through this as rapidly as we can.
Thank you. And we'll take one more question on the phone. Operator.
Thank you. Merci. Prochaine question, Philippe Vincent Foisy, Radio-Canada. À vous.
Oui, bonjour, M. Trudeau. J'ai une question sur les vaccins. Vous dites, là, je vous écoutais, que tout va bien dans l'approvisionnement des vaccins. Par contre, quand on regarde ce qui s'est passé en fin de semaine, même votre ministre de la Santé qui dit on a envoyé des millions de doses aux provinces qui, elles, tardent à vacciner. Donc, quand les gens se demandent pourquoi je ne suis toujours pas vacciné alors qu'on a reçu 10 millions de doses, est-ce que c'est de la faute des provinces? Est-ce que c'est ça le problème en ce moment? C'est là le nœud? C'est là que c'est compliqué pour l'opération vaccination?
Je pense que les gens voient bien qu'on a livré énormément de vaccins au cours de la dernière semaine et on va continuer à en livrer énormément. C'est ça la responsabilité du gouvernement fédéral, d'obtenir des doses de l'international, de payer pour ces doses et de les envoyer aux provinces. Mais évidemment, comme tu soulignes, on va être là pour aider les provinces à les administrer le plus rapidement possible s'ils ont besoin de notre aide.
Un suivi, Philippe?
Oui, qu'est-ce que ça veut dire, ça, dans le concret? Vous pourriez les administrer concrètement. Qu'est-ce que ça veut dire, cette phrase-là? Puis aussi, les gens regardent les millions de doses et se disent, moi, je ne suis pas vacciné. Comment ça se fait?
Je pense que les gens reconnaissent qu'on doit tous accélérer le processus de vaccination et ça se fait quand on a des livraisons de plus d'1 million de doses de Pfizer par semaine, ce qui est prévu pour les semaines à venir, beaucoup de doses de Moderna, d'AstraZeneca, bientôt de Janssen qui va commencer à arriver au Canada aussi. Nous allons continuer de faire notre travail pour assurer la livraison de plus en plus de doses à travers le pays. Mais si les provinces ont besoin de ressources additionnelles, d'aide additionnelle, on va être là avec les ressources pour s'assurer que ces vaccins soient administrés le plus rapidement possible.
Prime Minister, it's Annie Bergeron-Oliver with CTV National News. It's been reported that there will soon be about 90 million doses of AstraZeneca sitting unused in the United States because the FDA has not yet approved AstraZeneca. Do you think it's right that the Americans are sitting on tens of millions of vaccines they can't use? And do you intend on asking President Biden for some of these doses to be delivered to Canada immediately?
We have continued to engage in conversations with partners around the world, including the United States, about getting more doses quickly. We recognize that the United States has actually already sent us 1.5 million doses of AstraZeneca, which arrived last week, and are looking at ensuring that their closest partners and neighbors, for economic reasons and for reasons of family and proximity, get vaccinated as quickly as possible. We continue in those conversations with them, and we're hopeful that we'll all be able to get through this quickly.
CBC, you're talking about the federal government potentially helping the provinces get more vaccines out. I'm wondering specifically, do you envision federal vaccine clinics? Like, what specifically can the government do to make sure more vaccines get out faster?
Well, for example, from the very beginning, we've been present in remote and northern Indigenous communities to help with vaccination efforts for the most vulnerable. That was part of our strategy from the very beginning. To recognize that in Arctic communities and northern and remote communities, we needed to take special measures to not go in back repeatedly for every time we drop the ages by 5 years, as the rest of the country has done, that we were just going to vaccinate over 75% of those northern and remote communities once, so that we're able to protect people. And those are the kinds of things that the federal government is doing. We have handled and been there to support the logistical rollout of vaccines and distribution across the country. And as provinces have asked for extra help, whether it's extra resources, extra medical personnel, or logistical support staff, we have been there to respond to them. The provinces in general have been very clear that they feel that the vaccination is something that they are able to handle on their own. But as always, we have a Team Canada approach. And if anyone needs extra help, the federal government will be there, as we have from the very beginning, whether it's on vaccinations, whether it's on contact tracing and rapid testing. We sent tens of millions of rapid tests to the provinces in the fall. We're continuing to work with them on getting them rolled out, whether it's on direct support for businesses, for communities, for individuals, for families, for seniors, for youth people. The federal government has stepped up with $8 out of every $10 spent on recovery and support during this pandemic coming from the federal government. We will continue to be there to make it through this final wave, hopefully, as rapidly and as effectively as possible. Okay. Depuis les tout débuts, le gouvernement fédéral a été là pour aider les provinces à travers cette pandémie. On respecte toujours la juridiction des provinces et il y a beaucoup de provinces qui nous ont dit non, ils n'ont pas besoin de notre aide pour livrer les vaccinations aux patients, mais certainement, on va être là pour continuer d'appuyer dans les endroits où on en a besoin, comme on l'a fait dans les communautés rurales et nordiques et comme on va continuer de faire pour la recherche des contacts, pour le dépistage rapide, pour les appuis directs aux petites entreprises, au système de santé et aux familles et aux travailleurs. On a été là depuis le début pour aider et on va continuer d'être là dès que les provinces nous demandent. Mais notre responsabilité primordiale, c'est d'assurer la livraison du plus grand nombre de vaccins possible le plus rapidement possible. Et c'est exactement ce qu'on est en train de faire. La semaine passée, on a battu tous les records pour les vaccins livrés, mais on sait qu'il reste encore énormément à faire et on va continuer d'en livrer.
And you're going to be talking to the Ontario Premier later on today. Ontario and Ottawa have been pointing fingers at each other in terms of supply of vaccine, distribution of vaccine. I'm just wondering, not just Ontario, other provinces as well. So how do you say there's a Team Canada approach to this when there's this level of sniping between the levels of government?
Well, I think we're in a situation where everyone is exhausted, not just families, workers, small businesses, frontline workers, but also leaders. This has been a very, very long year. And as a federal government, we've not engaged in pointing fingers or laying blame or judging. We're not going to do that. We are there to help. I made a simple promise way back in the beginning of this pandemic that we would have people's backs. And that's what we've done. Have we done everything perfect? No, of course not. But are we continuing to work hard every single day to get more vaccines into the country and to support provinces and territories on delivering those vaccines, of investing in contact tracing, in rapid testing, in supports for families, in this sickness benefit, for example, that we're announcing is renewed by 2 more weeks so that people don't face impossible choices about going to work and risking infecting your neighbors or putting food on the table. We have been there every step of the way to support the Team Canada approach, and we will continue to. Depuis les tout débuts, le gouvernement fédéral a fait un choix très simple d'être là pour les Canadiens pendant aussi longtemps que ça prendrait, avec tous les moyens que ça prendrait. Et c'est exactement ce qu'on a fait. Que ce soit avec la livraison des vaccins de l'international, que ce soit du partenariat avec les provinces sur le dépistage, sur la recherche des contacts, que ce soit avec les investissements comme le Fonds pour la relance. Nous allons continuer d'être là. Je comprends que les gens sont fatigués, les gens sont épuisés, que ce soit les travailleurs de première ligne, que ce soit les familles, les aînés, les jeunes, ou que ce soit les dirigeants eux-mêmes. C'est pas facile, cette pandémie. Et je comprends que ça peut être frustrant par moments. Mais en tant que gouvernement fédéral, on a été là pour les gens, on a été là pour les provinces et les territoires, et on va continuer d'être là en faisant tout ce qu'on peut pour livrer le plus grand nombre de vaccins le plus rapidement possible pour passer à travers tous ensemble.
Beeman, Global News. Hi, Prime Minister. With more younger people getting more seriously ill, as you know, that's prompting a push, especially in Ontario, to prioritize essential workers. Understanding that those vaccination decisions are up to the provinces, what do you think needs to change about the rollout? And will you be asking Premier Ford on your call today to prioritize essential workers?
I look forward to speaking with Premier Ford this afternoon and offering whatever support I can offer. We know that the situation is serious, not just in Ontario, but right across the country. And different jurisdictions are making the decisions that they feel are appropriate for them to keep people safe, to get through this as quickly as possible. And I'm going to check in with him to see what we can offer as a federal government to help get Ontarians and indeed all Canadians through this as quickly as possible.
And on essential workers, there are calls still growing louder for guaranteed sick leave. I understand that you've extended the recovery benefit, but are there talks underway at the federal level for guaranteed sick leave as separate from the benefit?
We brought in a 2-week sick benefit, recovery benefit to ensure that anyone who comes down with a sniffle or symptoms or has to self-isolate is able to stay home and not worry about being able to pay the rent or put food on the table. That was an initiative that the federal government went forward with, and given this third wave, we've extended it by another 2 weeks, so that's available for people. And if you want to find out how to apply for it, just go online to canada.ca, and you'll be able to canada.gc.ca, and you'll be able to figure out how you can apply for it, because we want people to understand that even during this third wave, the federal government will continue to be there to support them. Now, a number of provinces have moved forward as well with complementary measures, and I encourage people to look into the supports that they can get as well. We need to hold on. We need to hang in there to get through this third wave by holding tight and looking out for each other and flattening this curve, and everything we can do as a federal government, everything we can help the provinces do is going to help us get through this with one last push.
Good afternoon, Mr. Trudeau. Mana Hamidi with the Canadian Press. What's your reaction to the charges in Iran on the tragic airliner shootdown? Do you trust the justice system in Iran to deliver justice to the families of the victims?
We are tremendously concerned about the lack of accountability that Iran continues to have on this issue. The lack of transparency, the lack of a full and total investigation means that Canada, along with our fellow countries in the International Contact Group, will continue to put pressure on Iran to deliver true accountability and justice, compensation for the families. I spoke this morning with President Zelensky about the ongoing criminal trial and got an update on that. We will continue to work with the international community, work to reform international aviation standards, and mostly work to make sure that the families that I had the opportunity to meet with and sit down with, who continue to be heartbroken and will for the rest of their lives on the losses of these loved ones, get closure, get compensation, and mostly get justice from Iran.
Thank you. That concludes the time the Prime Minister has. The doctors and ministers will still be around for questions in just a moment. So we'll go back to the phone for questions. Operator?
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, this question's for Minister Hajdú. I'm wondering, the Conservative leader, Mr. O'Toole, today called for a post-pandemic public inquiry to examine the government's actions throughout the inquiry. I'm wondering what you make of that. I know you suggested there would be some kind of review after the pandemic is over. Do you think a public inquiry is the right forum for that?
Well, thank you very much, Ryan. And I think the Prime Minister and I have both said that every country should do a full review of their pandemic response when we are through this crisis. Clearly, every country has a lot to learn, including Canada, and we have committed to that. And so, obviously, from our perspective, there needs to be a foundation so that we have a full accounting of the lessons learned through this pandemic that can be applied to better preparedness for the next global health crisis.
Follow up, Brian?
Yeah, I know there have been reports coming out of a few cities about vaccine appointments going unfulfilled, and there's still some people who aren't, at least not rushing out to get a vaccine when they're eligible. I'm wondering if you're looking to do something to address that hesitancy and maybe also give people an idea of what parts of their normal life they can return to by getting the vaccine that might incentivize them to kind of get it.
Thanks very much. It's a great question. And yes, we have had our minds wrapped around vaccine hesitancy for quite some time. In fact, we launched a call for proposals to community organizations and other groups that can work within, for example, specific cultural groups or faith groups to apply for money to disseminate information in culturally appropriate ways. It's a $53 million fund. And I encourage a variety of different community groups to check out the availability of that money that can help them with disseminating information to populations that may prefer to get information in different ways and in different languages. We also have ongoing messaging to Canadians about the benefit of vaccination, and we'll continue to do that and evolve our messaging as the vaccination campaign evolves. And then finally, yes, I think the Prime Minister referenced this in a question earlier around vaccine passports and what can you do when you're vaccinated. We're working on materials. Of course, those materials will evolve as the evidence and research evolves. I know Dr. Tam has spoken about this a lot, and maybe I'll turn it over to her to speak a little bit about what we're still learning through research about onward transmission from people that are vaccinated. Dr. Tam?
Yes, I think in the area of vaccine confidence, that besides the delivery of lots of vaccines, that is going to be the key area of focus, I think, for work for the whole of the public health system in Canada. And I think the really criticality, as Minister Hajdú said, is that it's not just the broad messaging, but the more targeted approach to different communities. I've been fortunate to be able to participate in a number of those sessions. I've been very impressed, for example, for Black physicians and in partnership with Black North, for example, business leaders are able to outreach to their communities. And that's some of the most effective ways of doing that. Business leaders as well as faith leaders and health workers who can reach out to those communities because they have a trusted voice. I think our role is to provide them with information on the effectiveness, the incredible effectiveness of these vaccines in preventing serious outcomes and death. So for any individual, that's the key message, is that it stops you from experiencing severe outcomes. And even though, of course, the most severe outcomes are in older age groups, as we've seen even in younger populations, while still relatively rare, as numbers increase, you might be the one that is going to have a significant illness. So that is really important, even for the younger population, where I think vaccine confidence is not as high as we would like, because there's a perceived perception that they're less at risk, of course. So I think this current third wave with the variants thrown in is really important message that any age group could potentially have a serious outcome. And that is a primary reason for getting vaccine. That is the benefit you're going to get. And then the other message is that really the vaccine is there for individuals to protect each other. No vaccine is 100% effective. Even a 90% effective vaccine still leaves 10 out of 100 people who are vaccinated who may not be protected. So you depend on other people getting vaccinated to protect each other. And some people can never get the vaccine or will never mount a sufficient immune response to it. So getting as many people vaccinated as possible is the strategy, and particularly at the time when the variants, when the pandemic is escalating in Canada. So I think that's what's to focus on, is what the vaccines will do is help us, together with public health measures, get this third wave under control. So I think that's the focus. Of course, beyond that, depending on your epidemiology, which is different in different parts of Canada, whether you're in Newfoundland versus in Toronto right now, you will be able to undertake increasing different types of social interactions, both as a result of the success of your public health measures and vaccinations. So it is a difficult period. I think what our message is, focus on protecting each other as well as protecting yourself from severe outcomes.
Thank you, Doctor. Prochaine question, operator.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Oui, bonjour à vous tous. Ma question est pour les docteurs. Vous avez dit dans votre allocution d'introduction que le vaccin allait être moins efficace contre le variant P1. Je me demandais si vous pouviez nous donner plus de détails sur les preuves finalement qu'on a que le variant P1 est plus résistant au vaccin contre la COVID-19. Merci.
Merci pour la question. C'est Dr. New. Peut-être moi, je peux commencer. C'est sûr que les entreprises, Pfizer, aussi Moderna, tous les fabricants des vaccins continuent à évaluer, faire des expériences dans leur laboratoire contre le virus, incluant les variants, pour voir si les vaccins sont encore efficaces. Jusqu'à date, la plupart des vaccins et aussi la plupart des variants sont encore susceptibles avec les vaccins, mais c'est quelque chose à suivre. On sait aussi avec l'expérience dans des autres pays, comme par exemple l'Afrique du Sud aussi, que quelques variants, les vaccins sont moins efficaces. Donc, on n'a pas des chiffres exacts parce que c'est une situation qui continue à évoluer aussi avec les données probantes. On ramasse, on analyse les données probantes partout dans le monde, mais pour l'instant, c'est pourquoi il faut vraiment souligner le point que c'est très important. Les vaccins ne sont pas, comme on dit, la solution au complet. Il faut continuer avec toutes les mesures de santé publique, mais en même temps, on continue à vacciner de plus en plus les Canadiens, mais ce n'est pas seulement une question de vaccination. Donc, c'est quelque chose à suivre pour l'instant. Merci.
Une suivi, Catherine?
Oui, si je peux me permettre, écoutez, c'est juste que nous, on écrit les articles en ce moment et puis on est en train d'informer les Canadiens à savoir qu'est-ce qui se passe, qu'est-ce qui est la réelle situation. Donc, j'apprécierais si on pouvait avoir plus de détails sur P1. And maybe, Minister Haidu, you'd want to jump on this because, you know, we have Canada's top doctors telling us that one of the variants actually spreading and multiplying in Canada is actually resistant to the vaccine. So I was kind of wondering what was your message to Canadians right now, and also relating to travel? Should Canadians not go to BC because the variant P1 is multiplying there? Maybe if you could just kind of recenter the message around that and tell us what's the situation around P1. Thank you.
Do you want me to start?
Well, I could start to. This is Teresa Tam. I'll talk a little bit about this. So I actually, the Chief Medical Officers of Health had regrouped just to discuss the evolving situation with the P1 variant, including the clusters in British Columbia, Whistler as well, and some of the news that you would have heard about some of the clusters in Alberta. And we're also discussed with Ontario and other jurisdictions in increasing their gathering of information on this particular P1, but also doubling down on being really careful with case contact management, testing of contacts, double testing of contacts, chasing contacts of contacts to try and, as much as possible, slow down and reduce the spread of this virus. We said in our introductory remarks, Dr. New and I, after discussing with the chief medical officers, that now is not the time to travel for recreational purposes. We were concerned that, for example, if different people from different provinces ended up at a ski resort, that there are variants in those settings, that there's a potential for spread within Canada between provinces. So I think it's a very clear message that do not travel for recreational purposes outside your own, locality. Right now, that's really important. So secondly, in terms of why the P1 variant is important, we're still gathering information, as Dr. New says. There's still a level of uncertainty about whether this P1 variant causes more severe illness or not. They're not seeing that necessarily in BC. That is increased severity, but with increased numbers, they are seeing more people being hospitalized or going to the ICU. They are younger people because that's the population that were infected, the demographics. And so I think the message is P1 or other variants could infect younger populations and could cause severe illness. So do not be complacent, and we'll try and use different messaging for the younger population. Thirdly is that we don't have enough information from other countries, including Brazil, about how well these vaccines work against P1. There are only mainly laboratory antibody studies, which shows in some of them some reduced ability of the antibodies from a vaccinee to neutralize this P1 virus, which is a signal of concern. There's a mutation called E484K within this virus, which scientists think is possibly renders the virus to escape the current immune response, including the possibility for someone to be reinfected. That was the initial event that caused us to be concerned about this P1, is that there was a reinfection in a particular person that already had COVID-19 before and then got reinfected. That tells us that this virus might be capable of evading that immune response, but we do not have an actual vaccine effectiveness estimate that is solidified in terms of the evidence. And if Canada is seeing the evolution of spread of P1, we might be a country where we will be able to produce some of this data. And I also discussed with the chief medical officers that we need to look towards their leadership in gathering that information.
It's Dr. New. Maybe before I pass it to Mr. Hyde, I'll just outline three main points, exactly like Dr. Tam said. Number one, I think everyone on an individual level needs to take personal responsibility to the extent that's possible. We recognize there's issues, obviously, with essential workers and so on, but really, the personal protective measures that stay at home as much as possible, don't have sort of a non-essential travel, especially vacations going from one province to another. So that's at a personal level. The second point is that what governments and local authorities can do in terms of closing stores, lockdowns, et cetera, and so on. Certainly that's been in the news, and I certainly local authorities, I think, have a best understanding of what could or should be done, and we'll let that play out in terms of what provinces do in their own sort of situation. And then thirdly, of course, the vaccines. I think at the present time, everyone, I think, as soon as you get offered one of the approved vaccines in Canada, we all wait our turn, go get vaccinated. So all those things together, the personal protective measures, measures that the authorities can put in place at sort of at a population level, and then the vaccination, I think is the way that we're going to, hopefully I could say, get out of this sooner rather than later. Thank you.
Yeah, but sorry, if I may. So do we have proof that P1 is more resistant to vaccines? That's ultimately my question. It seems like you don't have any proof right now, what you're saying.
Yeah, it's Teresa Tam. No, it's just laboratory signals in, that the antibodies from vaccinees don't neutralize this virus as well. But that's the only clue we have. We don't have great information, but do get vaccinated because there is no black and white, turn on and off switch. There will be some level of protection. So still get the vaccine.
Hi, it's Patty Heidi speaking. Maybe I can just add a little bit here. I will just emphasize, I think the 3 points that Dr. New made are very, very important to remember, that in fact, what protects Canadians against the variants is less COVID, and less COVID depends on all of our actions. Canadians have sacrificed, as I've said before, as we've all said, tremendously over the last year and a bit. And the choices that provinces and territories are making now will determine how much more we all Canadians have to sacrifice as we get through this pandemic together. So it's personal decisions, it's the choices that provinces and territories are making. And of course, those are the kinds of things that will slow down or in some cases accelerate spread that will put Canadians at risk or protect their health.
Thank you, Minister. Next question, operator.
Thank you. Merci. Next question, Marika Walsh, the Globe Open.
Hi, thank you so much for taking my question. My first one is for Minister Hajdu. Your tweets last night seemed to be suggesting that you take issue with the speed at which the provinces and territories are rolling out the shots that they're receiving. Can you please clarify what pace you expect the provinces to be following? So how many days should it take from the time they receive the shots for those shots to be administered?
To be clear, Marika, the tweets last night were providing information that we post online in a more accessible format for Canadians, given how much conversation there is about provinces' doses received and doses administered. So it was a series of tweets that highlighted the number of doses that have been shipped to provinces and territories, the number of doses that have been administered by the date of that tweet, and a link to where Canadians can get information about their own provincial vaccination strategy. Obviously, everybody is anxious to get vaccinated. In some jurisdictions, in some provinces and territories, there's a high degree of confusion and concern, and so this information is presented to Canadians so that they have the facts as they try to figure out when their turn will come for vaccination.
Follow up, Marika?
Okay, that was not my question. My question is, how quickly does the federal government expect provinces to roll out vaccines? If vaccines are delivered on Monday evening or Monday during the day, how many days should it take for provinces and territories to administer those vaccines?
I think the Prime Minister was clear that if any province or territory is having challenges in administering vaccines that they're receiving,
though, Minister. My question is very specific.
Well, of course, provinces and territories are going to be administering vaccines as they get them. Our expectation is that they work as diligently as possible to get them out as quickly as possible. I think that's what Canadians' expectations are. Each province and territory has a slightly different strategy. We'll be providing data to Canadians as we have all along, so that Canadians, no matter which province or territory they live in, can understand how many vaccines at any given time a province has received, how many have been administered, and where to get that information about when their time will come.
Thank you. Next question on the phone, last one on the phone, operator.
Thank you. Merci. Next question is from Tonda McCharles, the Toronto Star. Line open.
Yes, hi. Thanks for taking my question. Minister Hajdu and perhaps Dr. Tam, can you address what is Health Canada and the Public Health Agency of Canada's plan right now for the border reopening? What metrics are you looking at in order for the country to make a decision about when the border should reopen?
Maybe I can start. And I will just say that clearly now is not the time to consider international travel. And we monitor a number of different metrics, including domestic spread and provinces and territories' capacity to manage cases in their own jurisdiction, as well as the situation internationally. Clearly, we find ourselves in the middle of a third wave for many countries around the world. We have global vaccination rates that are very disparate across the world, and of course, domestically, we see a number of provinces and territories that are struggling with increased caseload. So I'll just repeat that now is not the time to consider international travel.
And a follow-up,
Dr. Tam, are you able to weigh in? Yeah, I have a follow-up, but I had also asked Dr. Tam to respond. So I'll once I hear her answer, I'll ask my follow-up.
of course.
Yes, hello. It's Teresa Tam here. So I think Minister Hadu's outlined some of those considerations. One is what is the domestic situation. One is what's going on outside of Canada in terms of epidemiology and spread. And the other aspects is, of course, whether the provinces are coping with hospitalizations, ICUs, that kind of capacity. So we must be able to cope with any potential risks. And I think that's, absolutely critical. There are, of course, other considerations, whether it's operational or otherwise, that always needs to be taken into account. Right now, of course, we have put in place testing capacities and other capacities to enable the safe entry and quarantining of travelers. And so it's not just the public health rationale, but also what that operational elements might look like. So all of that has to be pulled together for our decision makers to take up that decision.
Okay, thank you. So I didn't hear in that metrics such as vaccination rates per 100 population or anything like that. So if I've misunderstood, just correct me on that. My other question for I guess Minister Hajdu, I didn't hear a clear answer to my colleague's question earlier. So perhaps you can address this. Are you ruling out eventually an inquiry that is actually public, a public inquiry? You were asked about Mr. O'Toole's call for that today. And so I'm not looking for whether there's a departmental lessons learned or an internal. I guess I'm asking, is this government prepared at some point post-pandemic, as you've said before, to initiate a public inquiry into its pandemic response?
Well, thank you very much. And I think both the Prime Minister and I have been very clear that a full investigation of Canada's pandemic response is warranted and required. And we will do that at the appropriate time. And as I've mentioned, we are still in a crisis. And so our focus remains right now on getting Canadians and Canada through this global health crisis, protecting our healthcare systems, Canadians' lives, and Canadians' financial security. And when the time is right, our government will be very open to examining very thoroughly the response of this country to the COVID-19 crisis.
So does full mean public?
I mean, Chanda, listen, I can't predict the nature of the inquiry, but I can tell you that we would want all Canadians to participate. So I will, I will say that we're open to, an inquiry that is as deep as necessary, including a public inquiry that gets to how our country can be better prepared to global health threats in the future.
With CTV. Hi, it's Annie Bergeron-Oliver with CTV National News. My question is for Minister Hajdu. Do you think the provinces are vaccinating people fast enough?
Is that we have millions upon millions of doses coming into this country every week over the next many weeks. And of course, all Canadians are anxious to get vaccinated. So I think we will continue, as I said, to be transparent with the doses that we receive into the country, how they're distributed to the provinces, and how they're administered. And I would say that it is important that provinces continue to make those difficult and hard choices, not just about vaccination, about also how to control the spread of the virus so that Canadians can see an end to this ongoing health crisis.
I'm going to try that again because you didn't quite answer it. Your government keeps talking about the ramping up of vaccines starting soon. You just mentioned that millions of doses are going to be coming in every week. Yesterday, Ontario only vaccinated about 76,000 people, and roughly 37% of doses that have been delivered to the province are sitting in freezers. So I ask again, are you concerned that the provinces are vaccinating too slowly? Do you believe that that is the case?
I think that it's hard for me to give you a general answer because, of course, provinces and territories have very different strategies across the country. But what I can tell you is we're watching closely, and we stand ready to assist any province or territory who's having a challenge in rolling out vaccination, whether that be through additional money, as my colleague Minister Freeland announced just a while ago, whether that is practical or technical support, whether that's support to reduce vaccine hesitancy in a variety of different populations, as I mentioned earlier today. But I will also tell Canadians that they will be readily able to get that information so that they can see in their own jurisdiction how many vaccines their province or territory has received and how many have been administered. It's important that provinces and territories continue their hard work, and we'll be there with them as they do this hard work. But of course, Canadians are anxious and they want to get vaccinated, and we know that time is of the essence. This really is a race between the virus and vaccination.
Good afternoon. This is Man Hamidi with the Canadian Press. My question is for Dr. Tam and Minister Hajdu. What role do you see the federal government for the federal government in prodding the provinces to ensure vulnerable workers, essential workers, get vaccinated as soon as possible?
So I can speak to this. Thank you for the question. I think it's very important that we understand, as I think Dr. Tam and Dr. New have outlined, that it's not just vaccination that protects vulnerable workers. In fact, we know that even some people who are vaccinated, admittedly only potentially 10%, but there are people who will still get sick despite vaccination. So it's important that vulnerable workers are protected in their workplace from catching COVID-19 using tools of public health. We need safe and healthy workplaces, and that's why our government has been there for provinces and territories with things like essential worker top-ups, with things in like the CERB, like the extension of employment insurance that provides for adequate financial supports for people to take time away from work and not go to work if they're symptomatic and get that essential test to determine if they have COVID-19. We have to remember that vaccination is a very important tool, but it's not the only tool, and that workplaces need to be safe. And of course, that is largely provincial jurisdiction. So it's very important that we protect vulnerable workers, and we do that with a variety of measures. And as I mentioned, the federal government has been there to support provinces and territories to take those steps.
It's Teresa Tam. I'll just add that, of course, the National Advisory Committee on Immunization provides recommendations that province and territory have been looking at and supporting. And in this second quarter, this is a phase 2 or stage 2. Of course, there is the need to protect the people who are going to get the most sick, which still remains some of the more senior population. But at this stage, there's also recommendation to prioritize frontline essential workers who cannot work virtually. and they have direct, close physical contact with the public. They can't work from home. And I know that a lot of my colleagues, chief medical officers, and within their jurisdictions are trying to roll out those kind of approaches and also offer vaccines to workplaces that have demonstrated high risk, including that they've had outbreaks. So certainly you can discuss the provinces and territories, but I know a number of them have targeted, for example, agricultural work settings, meat packing plants, shelters, and places. Of course, the long-term care homes were the first, but I know that they're looking at those strategies in terms of the current campaigns that they are setting out to do. Some of them, of course, with the data that they have, are targeting geographic areas where there's higher populations with more equity impacts, and they're often essential workers, and mobilizing your mobile clinics and providing information in different ways that these populations need to access information and access the vaccine. So the other thing that we do is try and share best practices at the Special Advisory Committee. So if some jurisdictions have tried certain approaches that worked, they then quickly share with the other jurisdictions as well.
Thank you. My follow-up is for you, Dr. Tam, too. There are signs out of many provinces that the people in ICUs are younger and most don't have any comorbidities that you have that could or would make have made them at high risk. Do you have any data that show how many more infections, how much more infectious and risky the variants appear to be for younger and healthier people?
Yeah, so based on the information I have from the other chief medical officers, many of them believe that what they're seeing is just simply an escalation in cases, and that young people, the proportion of the younger adults that are getting hospitalized is still about the same. It's not that the virus disproportionately is impacting the younger population, although the over the 80-year-olds are still doing well. They're the ones that perhaps are being protected by the initial vaccination rollouts. But increasing numbers means increasing numbers of younger people that could end up in the ICU. And ICU networks and physicians have observed that those increases in numbers. They have not provided any other sort of risk factor analysis at this point. Some of them may have underlying risk factors, but quite a number of them are previously healthy as well. And of course, that puts a lot of strains right now on the ICU systems. The province that has the most experience with the B117 variant, which is Ontario, has managed to provide a scientific analysis of what they're seeing to date, which suggests that, in line with some of the international studies, that the variant cases, B117 predominantly, are associated with increased severity, including hospitalizations and deaths. So that's the best data that we have coming out of Canada at this point.
Abigail Beeman, Global News. With this third wave, with cases rising and some reports of younger people being more seriously ill, I'm wondering if you believe that anything about Canada's strategy needs to change, given that in this third wave, we're also seeing a new level of pandemic fatigue, people who are tuning out, more protests against lockdowns. Does something need to change?
Maybe I can start. It's Minister Haidu, and then I'll turn to Dr. Tam and Dr. New. I think what the increase in infections across the country point to is that everybody needs to make hard choices. And we understand Canadians have been sacrificing tremendously. But we also know that the choices that provinces and territories make now about, for example, what can remain open and what should be closed will determine the kinds of sacrifices Canadians will need to continue making. And so I think Dr. New's three-point plan is a good one. It's about our individual choices. It's about the prioritization of health across the country and making sure that we have a strong, healthy landscape before we make choices about opening or reopening various parts of our economy. And finally, it's about working together collaboratively with the full understanding that it's hard to have a healthy economy if Canadians are not well. It's hard to have a healthy economy if people are afraid of getting sick when they go out. So we have to continue to do this hard work together. And of course, Canadians are expecting us to do it.
Yes, so with younger populations, as I said, is because of the increase in the escalation of the pandemic, maybe increased severity with some of the variants that we're seeing more cases in younger persons. So I do know that there's some very brave young people who've survived their experience with COVID-19 who are speaking out, making sure that their peer groups understand how serious the illness can be, even if these hospitalizations and deaths occur much less frequently than in senior age groups, and increase in understanding that there may be other impacts of being infected by COVID-19, including the current ongoing study of more longer-term symptoms can happen to previously healthy people. Those are just some of the facts that people need to understand. But I think outreach and using different methods to get through to different populations is very important. And so the influences of these different populations and generations we just talked about, whether they be through social media, lead influencers, or content creators, I think they like to be identified as. We've been engaging. And also workplaces, actually. A lot of businesses are trying to do their part in messaging, in providing testing or sort of supporting testing, testing for screening programs, as well as they are really trying to support vaccinations, getting the message out to their workers who may be young, these working age adults, helping them get to clinics, or setting up some clinics that may be appropriate for workplaces. So I think all of those things can help on top of supporting people to take some of the time off to get tested and vaccinated. So it's not really a one size fits all, but I think all methods have to be utilized right now to get people engaged.
Thank you.
Dr. New.
Sorry.
Yeah, the only other point I would stress again, and I think it's already been mentioned by Minister Haidu and Dr. Tam, is about, I think, the younger population. The fact that they're now also ending up in the ICUs and being hospitalized, I think is quite sobering. And I think you've seen probably in the last few days, and I think it's even hit me, the level of concern and anxiety, and not just public health officials, but also the clinical physicians, the doctors on the ground who are actually seeing these folks ending up, in hospital and ICU, previously healthy young adults. So, as we mentioned even earlier on in the pandemic, a lot of, I think, younger folks were probably thinking they weren't personally vulnerable, said, it's just going to be a sort of a mild illness, et cetera, and so on. And you're seeing now that, maybe with the variants and so on, that the situation is changing. So I think that's something we need to build on. And I think there's multiple means using, Facebook Live events. Dr. Tam and myself were involved with events such as that to try and get the message out. And I think young folks themselves, I think at this point, everyone probably knows someone who's been affected by COVID-19, be it a friend, a family member, and so on. And so I think people need to recognize that they need to do their part, but also share stories and show others that no one is sort of immune to the effects of COVID-19. Thanks.
Thank you. My follow-up question is for Dr. Tam. I'm just looking for some clarification on the question of younger people getting sick. I know that over the weekend, Adrian Dix in BC said that while the number of cases of younger people may be proportionately the same, just like what you said earlier, Dr. Tam, he said that the younger people, they're seeing that they're getting more seriously sick than before. So I'm just wondering if you can clarify, are you hearing that from other provinces too, that while the cases numbers may be proportionally the same, that younger people are getting more seriously sick?
Thank you for the question. I think that data is still being analyzed, but it's true that a number of chief medical officers have indicated that what they heard from on the ground is that younger adults, there's certainly increased numbers, but many of them deteriorate quite quickly and have to be admitted to the ICU quite immediately. And then, of course, they spend quite a bit of length of time staying in the ICU, which means that there's a capacity impact as well. So one of the interesting statistics that I presented in my remarks was that the hospitalization rates haven't gone up in a huge way, at least at a national global level, but the ICU admissions have gone up 18%. And that would perhaps be in line with some of these reports, if you like, from the medical officers who are saying that people might be going straight into the ICU very fast.
Hi, it's Tom Parry with CBC. My question is for Minister Hajdu. I just wanted to ask you again about that series of tweets that you put out. And I'm just wondering, in terms of laying out the deliveries versus the doses administered, did you feel it was necessary to do that given the complaints some provinces have been leveling at the federal government at what they say is a slow pace of deliveries? Just what was your motivation for thinking you had to lay out those numbers?
Well, thank you very much for the question. I think the motivation is that Canadians deserve clarity of information, not just about the doses that have been received in their province, the doses that have been administered, but also how to get clarity about how a province is prioritizing populations and how to get clarity about how they themselves sign up for a vaccination or find out more about how to sign up for a vaccination. So it's really about making sure that Canadians have access to transparent, updated information. We'll be retweeting this information every week so that we can, all Canadians can follow along as provinces and territories do that important work of immunizing their populations.
And the Prime Minister talked about this a little bit earlier, but I mean, are you concerned that any kind of level of sniping between the provinces, the territories, the federal government, that's going to detract from the overall goal, which of course is to get as many Canadians vaccinated as quickly as possible?
Again, the tweets that I sent out last night are factual in nature. They are the number of doses delivered to provinces and territories, the number of doses that have been administered to date, and where Canadians can get information. Canadians expect access to this information. They want to have credible sources of information. We've heard all along that it's confusing, that numbers are, flying out of a variety of different sources. And so we want to make sure as we move forward that Canadians can count on credible information that's updated on a regular basis. So as I mentioned, this information will be tweeted out weekly so that Canadians can follow along in our vaccination efforts as a country.
Thank you, ministers. Thank you, doctors. That concludes today's press conference.